They call me the doctor who still reads every label. I was born in the United States, trained in some of its finest hospitals, but I chose to settle in Japan where medicine is quiet, slow, and personal, where I still make house calls, where the pharmacy is a place of caution, not convenience. In over 40 years of walking the quiet villages and tending to the elderly of Japan, I've learned something that textbooks won't teach you. Sometimes, what saves your life can also threaten it if you don't understand what it truly does. We trust medications. We take them without question. We believe that if it comes from a doctor, it must be safe. But every month, I see patients with no history of heart disease who suddenly develop chest tightness, palpitations, fatigue, or worse symptoms of a heart attack. And when I trace the path back, it often leads to something small, something overlooked. A pill. Today, I want to tell you a story. Then I'll reveal the 5 types of medications that, while often necessary, can silently increase your risk of heart attack, especially after 60. These are not scare tactics. These are facts, backed by peer-reviewed studies and patient experiences. And if you or a loved one is taking any of these, it's time to ask the most important question of all. Is the benefit still greater than the risk? The case of Mrs. Nakamura. Mrs. Nakamura was 78, a retired school principal in a quiet Kyoto suburb. She had no major health issues. Her blood pressure was well controlled, her cholesterol reasonable. She walked daily, tended her bonsai, and led the local flower arranging group. Then, one winter morning, she collapsed while preparing tea. Her husband called the ambulance. She was rushed to the hospital diagnosed with a mild heart attack. No one understood why. Her heart was strong. Her arteries, clear. I reviewed her medication list. That's when I saw it. She had been prescribed a combination of medications seemingly harmless that together had pushed her heart over the edge. Now let me share with you the 5 medication types you must watch, especially in older adults. 1. NSAIDs, nonsteroidal anti-inflammatory drugs. Common examples: ibuprofen, Advil, naproxen, Aleve, diclofenac. These are some of the most widely used drugs in the world, taken for headaches, arthritis, joint pain. But few people know this. NSAIDs can increase your risk of heart attack, especially when taken long-term or in high doses. How they increase risk? They constrict blood vessels. They raise blood pressure. They increase clotting potential. They reduce kidney function, leading to fluid retention and strain on the heart. Mrs. Nakamura had been taking ibuprofen twice a day for shoulder pain. Her doctor never warned her it could affect her heart. Science says. A study published in BMJ analyzed over 400,000 people and found that taking NSAIDs increased the risk of heart attack by 20–50%, depending on the drug and dosage. What to do? Use NSAIDs only when necessary. Avoid chronic use without supervision. Explore natural alternatives like turmeric, gentle stretching, or topical treatments. 2. Certain antidepressants, specifically SNRIs and tricyclics. Examples: venlafaxine, Effexor, amitriptyline, nortriptyline. Depression is real, and treating it is essential. But not all antidepressants are equal when it comes to cardiovascular safety. SNRIs and older tricyclic antidepressants can increase heart rate, blood pressure, and cause arrhythmias. How they increase risk? They alter autonomic nervous system balance. They can cause QT prolongation, a heart rhythm issue. They may increase blood clotting factors. Mrs. Nakamura had been prescribed amitriptyline for insomnia. It's an old antidepressant, often used off-label for sleep. But in sensitive hearts, it's a risk. Science says. A study in JAMA Psychiatry found that tricyclic antidepressants were associated with a significantly higher risk of cardiovascular events compared to SSRIs. What to do? Always discuss alternatives with your doctor. Use lower-risk antidepressants like sertraline or escitalopram if appropriate. Address sleep or mood concerns through non-pharmacological means when possible. 3. Decongestants and cold medications, containing pseudoephedrine or phenylephrine. These are found in many over-the-counter cold and flu remedies. How they increase risk? They constrict blood vessels to reduce nasal swelling, but this also raises blood pressure. They increase heart rate. They can trigger arrhythmias or angina in those with pre-existing heart conditions. Mrs. Nakamura had caught a winter cold a few days before her heart attack. She took a decongestant tablet from the local store containing pseudoephedrine. That alone may not cause harm. But for someone already on blood pressure medications and with age-related vessel stiffness, it was enough to cause a storm. Science says. The FDA has issued repeated warnings about decongestants in elderly patients, particularly those with cardiovascular risk. What to do? Avoid over-the-counter cold remedies that contain stimulants. Use saline sprays, steam inhalation, or elderberry-based products. Always check with your doctor before taking cold medications, even if they seem mild. 4. Proton pump inhibitors, PPIs. Examples: omeprazole, Prilosec, esomeprazole, Nexium, lansoprazole, Prevacid. Used for acid reflux and stomach ulcers. These medications are often taken daily for months or years. But PPIs have been linked to increased heart attack risk, especially in long-term use. How they increase risk? They reduce magnesium levels, which can cause arrhythmias. They may interfere with nitric oxide, affecting blood vessel flexibility. They increase levels of a molecule called ADMA, which impairs vascular function. Mrs. Nakamura had taken omeprazole daily for 3 years without ever being reevaluated. Science says. A 2015 study in PLOS-1 found that patients using PPIs had a 20% increased risk of heart attack even without prior heart disease. What to do? Reassess the need for PPIs every 36 months. Use the lowest effective dose. Consider lifestyle changes for reflux, smaller meals, less alcohol, not lying down after eating. 5. Corticosteroids, prednisone, dexamethasone. These are powerful anti-inflammatory drugs used for arthritis, autoimmune diseases, allergies, and even infections. But they come at a cost. Raise blood pressure and blood sugar. Cause fluid retention. Increase LDL cholesterol. Promote fat deposition around the abdomen and neck. Mrs. Nakamura had a short course of prednisone a month before her event for a bout of bronchitis. That, combined with her NSAIDs and age, may have tipped the balance. Science says. A 2020 study in the Lancet Diabetes and Endocrinology linked corticosteroid use to increased risk of heart attack and stroke, especially in older adults. What to do? Use only when absolutely necessary. Follow with close monitoring. Work with your doctor to taper off slowly and replace with gentler therapies when possible. Summary: the 5 medications and their risks. Let's review the 5 categories that could increase your risk of a heart attack. NSAIDs raise blood pressure, promote clotting. Certain antidepressants, SNRIs, tricyclics, affect heart rhythm and pressure. Decongestants constrict vessels, increase heart rate. PPIs affect blood vessel function over time. Steroids raise pressure, sugar, and cholesterol. These are not forbidden drugs, but they must be respected, monitored, and revisited regularly. No pill should be taken forever without asking, is this still the right medicine for me? Final words from Dr. Raymond Kondo. Mrs. Nakamura recovered. She no longer takes NSAIDs daily. She uses herbal teas and turmeric for inflammation. She replaced amitriptyline with guided evening breathing and magnesium. Her cold remedies are simple, natural. She reevaluated her reflux and now takes her meals slower and earlier. And her heart? It beats steady. Because she listens now not just to her doctor, but to her own body. So I leave you with this. Your medication should help your heart, not harm it. If you take any of the drugs listed above, talk to your doctor. Not to panic, but to plan. To adjust. To protect what matters most, the rhythm that keeps you alive. If this message opened your eyes or gave you something to act on, please like this video, comment below with your experience or question, and subscribe to this channel for more truth-telling, soul-centered, science-backed insights from a doctor who still believes that healing begins with knowledge.